Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about a condition called Pre-Dislocation Syndrome. And we're going to do this exactly the same way as we have these last ones through answering the four questions. Number one, what is pre-dislocation? Pre-dislocation is basically a dislocation, usually of the second toe, by spraining the ligament on the bottom of the foot. So you actually have the second metatarsal and the second toe, and the toe starts to dislocate up because you've torn the ligament on the bottom there. It is usually very, very painful. You'll walk and you say, right at the ball of the foot, I have significant pain, I have significant discomfort, and I'm not able to function, not able to do what I need to do. And it will usually feel really swollen and so forth. Why does it happen? Question number two. Truth is, it's a sprain. It's a type of sprain of the joint, the second toe joint. So what you rolled across it, you sprained that joint, you tore the ligament just like an ankle sprain, and that ligament either lengthens or tears completely, and the toe starts to slide up, starts to dislocate, even though it hasn't completely dislocated. And it can be very, very painful because you're now walking on the joint instead of walking through the toe like you're supposed to. So it's pretty problematic. The most common is injury of some sort, where you've actually done a sprain or injury to that toe. That could be either from kicking it against something hard, that could be from sports sometimes, that could be from a poor functioning or poor fitting shoe. There are a lot of different reasons why it may happen, but it's actually an injury. Number three, how do you treat it at home? The truth is, if you want to, you could actually just tape the toe down. The best way is to run tape around it, and the tape should cross. You've seen the ribbons where for the different colors, like breast cancer awareness, those kind of things, where you have a ribbon that goes around and they cross. You're gonna do the same thing. You're gonna go around the toe, and then you're gonna cross right at the metatarsal head and pull that toe down. In doing that, you're actually putting that toe back in place, giving it an opportunity for it to heal. That is usually the easiest place to start. There are splints as well that could actually be utilized to do the same thing. If it's not getting better, that's number four, when you should be get it evaluated and get it treated. If you say, okay, the pain's getting worse, it's not improving, I'm unable to tape it, or I don't understand how to tape it, you can come in and actually be evaluated. They'll do an x-ray to ensure there's not a stress fracture to the metatarsal or to the phalanx, which is the toe. And by doing that, you can say, okay, yes, it really is pre-dislocation syndrome. There's some tests you can do, including you can push right on the joint and it hurts. If you pull the toe down and push on the joint again, it doesn't hurt. Called the Lockman's test. That actually confirms that it's actually a problem. Sometimes with pre-dislocation syndrome, it may require surgery, but most of the time through splinting and taping, you can actually allow it to heal, and it can get back to normal, or at least function where it's not causing you any discomfort this time. This is Dr. Brandt Gibson, and this is your Podiatry Tips, Day 165, Pre-Dislocation Syndrome.